Well, hello, listeners, and welcome back to Our Experts. I am Carol Matichka, your host and eternal pharmacy advocate. So we are, of course, bringing you various topics regarding pharmacy that hopefully you'll find interesting. I would love to get some comments and feedback for the topics we've had so far and be able to provide some other topics as well that our listeners are really looking to hear about. But today we are super lucky to have Dr. Jeanette Connelly. She is a dear friend of mine and special guest, and she's also the regional coordinator for the University of Florida in the Tampa region. So she truly is an expert on preceptorship and the art of training students in the experiential setting. So I know pharmacists have a lot of questions about precepting students, and at times, things have certainly changed, I would say, over the course of the past few years. And really how we train our students has changed to some degree as well. So I know everybody's looking forward to hearing from Dr. Connelly. So welcome.
Thank you so much for having me, Carol.
Absolutely. So I ask most of my guests this. Tell us a little bit about your background. How did you get interested in pharmacy? Where did all of that start?
Sure. Well, I am a University of Florida College of Pharmacy grad, so go Gators.
Go Gators.
And I first became interested in pharmacy actually when I was in high school. So my grandfather had had a stroke, and so I started taking him to his doctor's appointments and managing his medications to the best of my ability back then. And I worked part-time in a grocery store, and they said, "Hey, would you be interested in learning how to work in the pharmacy? We have a technician who's leaving." And I said, "Sure, why not?" And so I did that, while most of my friends in high school and college were waiting tables, I was a pharmacy technician. And I kind of chickened out going to pharmacy school during undergrad, and I became an elementary school teacher. And then when I was older and a little bit wiser, I decided to go back to school. And that's when I applied to UF to go to pharmacy school. So it took me a little while to get there, but I got there.
Well, I can imagine your background as an elementary school teacher is actually very helpful. We certainly teach students, so just that process of teaching and understanding that, I think, is extremely important. And of course, now you're continuing to teach students, but at a different level. So it all comes back full circle.
It really does.
So tell us a little bit about precepting, and what does that mean, precepting a student, according to Dr. Connelly?
Sure. So for me, precepting is really being an integral piece of a student's overall growth and development. So in the pharmacy program, especially, we have students who have their APPE, or we call it their APPE rotations in their final year of pharmacy school. And so at UF, there's 8 different rotations, and you can have a different preceptor for each one of those rotations. And so for me, preceptors are example setters. They help bridge those gaps for students that exist between, coming out of that didactic curriculum and going into that, real life practice setting. And so they're important teachers, and they really are helping shape the students during that APPE year. Most people may not realize that when students are going out on their APPEs at first, most of them may not have an idea of what area specifically in pharmacy that they want to go into, post-grad. And so these experiences really help them decide, what am I interested in? What do I like? What do I don't like? Where am I going? Mm-hmm. So preceptors are so important in really helping to shape students and their growth.
Absolutely. So along those same lines, why is it then important as a preceptor to want to take students, in your opinion? What does it do for the preceptor?
So I think precepting students is a win-win for everybody. So I think it's a win for a preceptor because it helps the preceptor to feel that they're giving back, because they are.
Absolutely.
It also helps us kind of stay up to date of what's going on. I know we do our continuing education that we have to do to renew our licenses, but it's really great to see a student who's super energized coming right out of their curriculum, talking about maybe a topic that you haven't thought about as a pharmacist in a while. Maybe you don't have a large number of patients experiencing a certain health condition and things, and really just getting this super energized student that has all of this knowledge they want to share with you about that topic. So it's really great for you as a preceptor. It also is terrific for the student, because what they're getting out of this is they're seeing pharmacists that, maybe you've been licensed for 2 or 3 years, maybe you've been licensed for 30, 40 years, and they're seeing someone who still cares so deeply about the profession and what we do, that they see that how it's rewarding for the preceptor. And so I think it just sets a really great example for the student of what they can do in the future with giving back to the profession as well. So I think it's a win-win for everybody when you decide to become a preceptor.
I couldn't agree more. And I think you used a great term, energizing. It is absolutely energizing. So thank you for sharing that. And I introduced you as a regional coordinator. So can you explain what that means?
Yes. So a regional coordinator, the best way to think about it is we're like a liaison, really, between the College of Pharmacy and the pharmacy sites and the school, right? So we kind of bridge that gap there. We assist in a number of different items. We recruit sites, we inspect the sites to make sure that everything is going the way it's supposed to go at the sites. We triage any issues that could arise with a site or with a student. We provide support for the site and preceptors. A great example of this is continuing education. And, for me, I really became interested in doing this, becoming a regional coordinator, because I had a really great experience with my regional coordinator. So I was a student at the UF St. Petersburg campus when that campus was open rather. And at the time, my children were really small when I was going out on my rotations. And so I needed some extra support myself from my regional coordinator. And when I saw that this position was open, I thought to myself, I really appreciated everything that my regional coordinators did for me when I was going through rotations. And it really appealed to me to be able to do the same for somebody else.
Oh, that's fantastic. And you truly are that point of contact when you're trying to figure out who to reach out to if you're precepting students. So absolutely. Thank you for sharing. And you've been a preceptor now for many years, but I'm sure that being a student, not too long ago really helps play into what you do with your current students. So what are some of the differences that you encounter with students in 2023 compared to your time, let's say, as a student, and perhaps maybe even compared to when you first started precepting?
Technology. So technology is, it's growing, it's evolving all the time. And when I was a student and when I was first precepting, there really wasn't a virtual rotation. You didn't really see as much with televisits or telehealth. Maybe a little bit with some rural populations with the VA had some a virtual piece, but it looked very different than it does today. And now students have amazing opportunities, and we have so many diverse rotations. Really, anything that you could be interested in, there's a rotation for that. And technology plays a very large role. And I think it's really wonderful to be able to see that. It can be, I think, a little intimidating sometimes, in the sense that I think the younger students catch up to the changes in technology maybe faster than some of us pharmacists that have been around for a little while have. but it really, I think, allows the students to be more proactive with their communication to their preceptors, which is, absolutely terrific. And I also think with any generation, you see differences in generations with the way they like to communicate. And so that's a big difference now too. I think, before maybe preceptors were used to getting phone calls, and now they're getting more, the email route, instant messaging and things like that. So just kind of keeping up with technology as it's evolving, because it's always evolving.
Absolutely. And speaking of that, how does AI, has that been playing into what you're seeing in regards to precepting students?
So AI is definitely a big topic right now. And I know that is something that I believe all the colleges of pharmacy are looking into, as far as, how AI can play a role, because it's something that must be taken into consideration, but it's still just so new.
Yeah.
I know at the preceptors at my site, when some of the AI and ChatGPT and things like that started becoming available, we started asking it questions to see, how deep does this really go into looking at things and stuff like that. And what we discovered is that, you can't always take into account is it going to look at the right guidelines or something that's been updated and stuff. And so I think right now it's still so early with that piece with AI, but it's definitely, it's something that is not going to go away.
Right.
And something that I think is going to be looked at pretty closely. I would imagine we're going to see that more in the curriculum in the future.
Sure. And I imagine students will be using a lot more of it, particularly as we look at patient data sets and using AI to generate results there and provide information. There's so much behind AI, and I get a lot of questions from students in regards to utilization and how to properly use it. So I completely agree. It's definitely evolving. I could bet next year at this point in time, we'll be having some more interesting conversations as we delve more into AI.
Absolutely.
So, yeah. And we'd really be fooling ourselves if we don't think we had challenges years ago as we do today. So I do want to put that out there. But how do you manage some of the challenges that you deal with preceptors and with students?
Yeah, I think for the most part, whether it's a challenge that a preceptor is experiencing or the student is experiencing, it's realizing, what are my resources? What do I have that is going to help me triage this and figure out what is my best approach for tackling whatever the situation might be. And there are so many resources that the college makes available to the students and to the preceptors. And that's one of the many things that we do as regional coordinators, where if someone's feeling overwhelmed, where we'll talk to them and say, okay, hey, I've got, these 5 different things here that you can do, or I've got this over here, and really helping to point the students and the preceptors in the right direction. Because the resources are there, but I think sometimes when someone's feeling overwhelmed, they really don't know where to look. And so we need to help point them in the right direction, because we want everyone to be successful.
Absolutely. And I think that's something that we need to reiterate, I think, even more, is that the resources are there. I know that, thinking back to just as I deal with my work with Drug Free Duval and all of the resources and the community resources we have, but a lot of people just are very unaware of them. So just making sure that information gets out there. which sometimes it's almost information overload. There are so many resources and there's so much. So now you have to really sift through everything that you've got to try to figure out what you really need. And I think that's where you then, as a regional coordinator, can also help them pinpoint what exactly they need to be looking at or what resources too. So that's great. Thank you. And do you have any specific examples that you can share with the audience in regards to maybe a situation that you had to manage and how you managed that?
Sure. Yeah. So I think overall, society has really seen an overall increase in the last few years since the pandemic when we talk about things like burnout, mental health issues, and things like that. And we see that for students, we see that for preceptors, and so the college has done a tremendous job tackling those issues. So creating continuing education courses that we give specifically to preceptors on how to deal with burnout, how to identify at-risk students, and then the resources that of who they can be in touch with at the college that can help with all of those specific processes. And I think that's really been a game changer for some of the sites to see that it's not just how do we help with knowledge base with a student, how to help a student, growing with just within their appies and professionalism, but also how important just they are as a human being, as a person, and what they're going through. And so that's been a really big part of what we've been doing. And it's just been a really wonderful resource for preceptors.
That's great. Do you feel like you've seen an uptick in regards to personal challenges with not only students, but preceptors as well, and having to manage that with COVID, especially in these past few years?
Yeah, I think there's been a lot of procedure and policy changes in institutions since the pandemic. And everyone's having to shift and adjust to those changes. You see things on the news about, staffing shortages in certain locations and things like that. And so in some instances, they're having to do more with less. And
Right.
these sites, they're still taking our students and they're still helping to grow the profession. And so being able to provide that additional support, I think really makes it just better for the student, better for the preceptor and for the site. When you feel that you have support, that really makes a huge difference.
Couldn't agree with you more. So for the most part, we have really incredible students, and I think we overlook that 90% of students that we deal with on a daily basis, and oftentimes we'll focus sometimes on the 5% or 10% of students who really need some more guidance. So can you share some students who have done some amazing things at their sites for not only their patients, but the preceptor and the site in general?
Absolutely. And yes, for the most part, almost all of the students that you have are going to be terrific students that are ready to hit the ground running on their rotations. And these students really make a difference in the sites that they're located in. They do fantastic jobs, they're engaged, and they're valuable members of the healthcare team every day that they're on their rotations. They're involved in all aspects, all the pieces of the direct patient care process. We have, I saw a post recently this week. There was, ASHP mid-year that was just taking place in Anaheim. And I was so proud to see all the UF students that were there that had created poster presentations that have been involved in these longitudinal projects with their preceptors at sites. And then now they're getting to, present it at conferences and in meetings, which is absolutely terrific to see. I know that at my own personal site, we have had students over the years that have come in and made suggestions on, changing templates that we do. And, we'll always let students do things like that when they're interested in it. But there's been times where we've said to ourselves, this is better than how we had it before, and that fresh set of eyes, that, different generation perspective on how we were doing something, and it leads to a shift, right, in how we move forward. And then those students can see you're really making a difference. I had a student last year who was participating in a pharmacy and therapeutics committee meeting and presenting on a medication and made suggestions about our formulary that were terrific, that we implemented. And that student felt like, wow, I'm just on a rotation here, and my input was valued. And they're letting me make suggestions about formulary stuff. And so it really is, there's so much that the students do and contribute that you really don't realize it until you have the student there and you see it with your own eyes, what they're able to do and contribute toward your site.
Absolutely. And I think recognizing that they are soon to be your colleagues very, very soon, and really making sure that they feel like they're a part of the entire process in the healthcare system or pharmacy that they're at is such an important piece. And you're right. I've just heard so many incredible stories about the impact that students have made. So there's no doubt that times are tough for many pharmacists right now. Unfortunately, you actually touched on that in regards to workload. It's been very challenging, and students can really be an important piece of that puzzle to help in regards to taking care of patients at our sites. So tell us maybe some ways in which students can help in that regards.
Yes, I always recommend to students to really have conversations with their preceptor at the beginning of their rotation and talk to them, about their site. What are some challenges that the site is currently having with their patients, maybe their patient care process, and having the student talk to their preceptor about what can they do. Is there anything that the student can do to help with improving the process, bridging the gaps, really being a resource for the site? And this obviously helps the site, but it helps the student grow. It helps the student learn how to identify maybe pain points within different institutions. And if they're getting that experience, 8 different times over the course of that API year, then think about how that helps them be ready for when they're at their own practice site, one day. But a lot of times, if you don't have that conversation with the preceptor and really reiterating to them that, you're there to learn, you're there to have a great experience, and you're there to be a part of their team. When you're there for that 6 weeks, you are a part of that team for 6 weeks. And I think that it starts them out on the right foot, right, and allows the student to feel that they're getting experiences that are of value. They're not just doing busy work. There's a reason why they're doing this assignment. This is how the assignment helps the patients, helps the site, and helps the student grow. And I think it fosters relationship building and growth.
That's great. And I think when you talk to any preceptor, they'll say that the rewards and really the joy of mentorship and teaching are such a huge reason for why they even do this. So tell us a little bit about that piece, that mentorship piece.
Absolutely. I think there's many pharmacists out there that would like to be preceptors, but maybe they feel, I don't think I have the time for this, or I don't know if I'm going to be good at this. And I can tell you that, yes, being a preceptor is hard work, but the reward makes the effort 100% worth it. And that is because you are investing in the student, which in turn is an investment in the profession overall. Because how many students are you going to precept over the years? And every one of those students that you precept, you have made a lasting impact in their life. And one day, that student you precept is going to be precepting their own students. And
Or
what
taking
you
care
did
of
for
your
them,
family.
yeah, potentially
Sure.
taking care of you or your family
Yeah,
one day.
absolutely.
And so, yeah, it's a huge responsibility and step, not just for that student, but for the profession in general. And I would tell anybody who is a preceptor that you're not just a preceptor, you are an active advocate for the profession as a whole when you precept a student. It is that impactful.
It truly is. And I have heard that before. You stated that some pharmacists might be nervous and might feel like they're not able to offer students the learning environment or enough at their site. But I will tell you, every site has something to offer. Every pharmacist has something to offer. And sometimes you don't realize that until you have a student and see things through their eyes. So it's quite an amazing process. It truly is.
It really is.
Well, thank you so very much, Dr. Connelly, for taking the time out of your very busy schedule to chat with us today. Is there anything you want to leave the audience with?
Well, thank you so much for having me. It was really great to be able to come out here today and to speak with you and participate. I would say for the pharmacists out there, if you're currently a preceptor and taking students, I just want to say thank you. And please keep taking them. You make a difference with the students and with our profession. And for anyone who thinks that they're interested in precepting, to reach out to that College of Pharmacy. Every College of Pharmacy is going to have an office of experiential programs, and they're always looking for preceptors. And so if you're interested, contact the schools that you're interested in. They would love to hear from you, and they'll put you into contact with the regional coordinator in your area to have a conversation with you to see if they can set you up as a preceptor.
Thank you. Yes, that's extremely helpful. Well, thank you everyone for listening. And if you'd like to learn more about precepting students with UF, you can visit the Office of Experiential Programs, and we'll have the link for you in the show notes. Just click on preceptors from that link that I provide. So take care, everyone. Happy holidays.